LGBT. Most Americans know that stands for lesbian, gay, bisexual, and transgender. These people often experience the hurtful behavior of those who are uncomfortable with people different from them. Part of these negative behaviors stem from the lack of familiarity. But with the recent spate of popular TV programs depicting the LGBT lifestyles, some of this unfamiliarity is diminishing. Today we'll become familiar with other dimensions of sexuality beyond LGBT, and hopefully it'll have the same effect of some familiarity with something that's unfamiliar. We'll learn about demisexual, demiromantic, pansexual, and others. Welcome to Insights. I'm Dick Goldberg, and with me today is Gabe Javier. He is the Assistant Dean of Students and the Director of the LGBT Center at the University of Wisconsin-Madison. And also with us is Cabell Gathman. Dr. Gathman has taught courses at the University of Wisconsin in social inequality in general, and gender, sexuality, ability, and race in particular. She is also the chair of Wisconsin 521, which is an advocacy group for bi and pan people. Thank you both for being with us. Why don't we begin? I don't know who is going to spew data forth faster, but how big is the world of LGBT and others?
Gabe, would you like to?
Sure. Thanks for having us. I think this is a really hard question to answer. As you talked about in the introduction, there's a great deal of fluidity when it comes to the identities in between and outside the gender spectrum, but also across LGBTQ identities, in particular sexual orientation and attractionality. So for numbers folks out there, it probably won't be a satisfying number because it's really hard to pin down. One of the challenges with studying LGBT populations is that self-identifying as LGBT means a lot of different things. So in any given number of research, for example, one has to have an own sense of their own identity before they feel like they can be counted. And alongside that, I think people who identify as bisexual or pansexual or have shifting fluid sexual orientations and attractions may not see themselves in the traditional categories of lesbian, gay, or bisexual. Now, we also have that 10% rule, which is an overestimation. We have anywhere from numbers that say 1%. So, I don't think it's acceptable for us to say it's between 1 and 10%.
It is or is not acceptable?
It's probably not acceptable. I think that it would be, this just offers too wide of a range of numbers, really.
Well, you mean it's not very scientific to say 1 to 10. Is it possibly more than 10?
Certainly, I think in certain urban areas or places, I think, we often address this. So in the context in which I work with college students, for example, if you were to count and ask college students at their freshman year if they identify as lesbian, gay, or bisexual, you'll get a different number than you ask the same class their junior
I assume the
year.
number goes higher.
Perhaps.
Perhaps?
Yeah, I think
you don't know?
Well, I think that, we don't know, because I think, again, people's identities shift.
So someone might come in and say, I'm gay, when they're a freshman, and in the end say, no, I'm just a straight heterosexual, then they're senior?
That's probably one of many different options.
But it happens.
It doesn't not happen.
Wait a minute. That doesn't fit with what I know, but you know much more than me. But so I'm being try to be humble. But it would seem to me a very rare occurrence when someone goes from gay to saying, now I'm coming out, I'm straight.
Well, we need to consider, for one thing, that identity is different from attraction or behavior, okay? So we may find that some people take a long time to figure out how they want to self-identify, and particularly as a bisexual woman and working with bi and pan people, you see this, that two people may have very similar attractions and may even have very similar sexual histories, but one of them might identify as bisexual or pansexual and the other might identify as gay or lesbian or as straight. So we do need to keep in mind that these are social categories. When you take on a self-identification, you're also kind of affiliating yourself with a particular community.
I'm getting kind of scrambled in my brain trying to put this together. So maybe if you're willing to put order to this, what are these different ways of categorizing and talking about sexuality? I've heard Gabe at one talk, which is why I thought this would be a good idea. You laid out the 4 different ways of identifying.
Well, not 4 different ways of identifying, but necessarily there are 4 elements of self that we all have.
Okay.
Right? So at least 4. The first is physical or biological sex. So that is our sex assigned at birth. On a binary, we often think of that as male assigned at birth or female assigned at birth.
Okay. That's pretty easy to identify.
Perhaps. I think there's lots of categories in between. And I think that an overall thing for those listening and thinking about how do I integrate that into practice is understanding, A, we're taught a binary on all of these categories, but the binary is incorrect.
You mean male, female?
Correct.
Incorrect?
Incorrect.
Well, wait a minute. I'm born a male. I look like a male. I have all the male plumbing. Why would I not look and someone would say he's physically male?
What does it mean to look like a male? When
Oh
you
my
see
goodness.
someone on the street and you decide, you make a determination, right? Gender is very important in our culture. When people are pregnant, the first thing we ask is it a boy or a girl?
Yeah.
But if you actually think about what you use as cues for whether a person is a man or a woman, I think when people talk about being born male or female, we're primarily talking about genitals.
Yes,
We're not
yes.
talking about chromosomes even, because in most cases, we don't know a person's chromosomes. We don't test for them because there's no reason to do so. When we look at an ultrasound and assign a sex to a fetus, we're still basically just looking at their genitals. And in fact, somebody can have, for instance, XY chromosomes, but develop what we would consider feminine genitalia, a vulva, and they may have internal testes so that the testes don't descend. There are some chromosomal...
How would you identify that person's physical sex?
That person would probably be identified as female at birth because there's no reason to check the chromosomes. There's no reason to check, to assume that they might have internal testes. That's actually fairly common when we talk about intersex people. So intersex people are anyone whose physical genital appearance, hormone levels, chromosomes, any of that may not fit on what we consider the biological binary of male or female.
Okay.
They may have some combination that isn't what we expect. Some of them are identifiable at birth, as in cases where genitals may have an intermediate appearance, so that, for instance, the clitoris, which develops from the same fetal tissue that the penis develops from, the clitoris may be larger than what we consider to be in the quote-unquote normal range.
What does that mean in terms of sexual identity?
It's 5'9" in terms of sexual identity.
It is
Or-
not related to
That's
sexual
right.
identity. So
Is that a sign this person might have chromosomes that are mixed? Or
not necessarily.
Not necessarily.
So we talked
Okay.
about these 4 different senses of self. The first being physical or biological sex on a
Okay.
binary male or female assigned at birth, but we know that's beyond that. The second element of self being gender identity, which is our true sense of internal self.
Okay, so you can be physically male and
Internally-
gender identity could be female or something else.
And the terms that we use there are on a binary are man and woman.
Or what? I'm sorry.
Man and woman.
Yeah.
And then a gender expression, how we express to the outside world based on our cultural, sociocultural context and time, and the
So the
terms.
sense of order, can we go just to the 3 you've mentioned? Let's take a person who kind of crosses over into different, is not traditional.
Let's not. Let's actually
No?
start with a traditional person.
Okay.
So why don't we talk
Good.
about Arnold Schwarzenegger?
Okay,
So
good.
Arnold Schwarzenegger is male assigned at birth. When Arnold Schwarzenegger was born, the nurse presumably saw a penis and testicles and assigned him male.
Yes.
And let's also assume that Arnold Schwarzenegger internally feels as if he should be a man. He says, my physical sex assigned at birth organs match who I feel inside.
Okay.
And we also know him to express as masculine. The sociocultural context that we have is that he has muscles.
So gender expression, he's male, male, male.
Male, man, masculine.
Male, man, masculine.
And then we
Okay.
also are told or taught that he is a person who is attracted to the opposite or other gender. So, and he's a man attracted to women. So we say that he's heterosexual or straight.
Okay, what category is 4? You got physical sex, gender expression, and number 4?
and sexual orientation or attractionality. So
Sexual
who we are
orientation.
attracted to.
Okay, let me review those just one more time.
Sure.
Physical sex, what physically you look like sexually.
Sex assigned at birth.
Sex. Gender, which is what you identify
Our
as.
gender identity.
Do you feel male or female?
And you'll see
Gender
even
identity.
young children, typically around age 2, kids usually have a sense of their gender identity. They'll say, I'm a boy or I'm a girl, right?
Well, hold on now. Let's say they're physically a boy.
Okay, assigned male at birth.
Yes. How many 2-year-olds are, because of social pressures, what they're told by their parents, going to say anything other than I'm a boy?
There are actually a fair number of young children who will say, I am a gender that is not what they were assigned. And what we see now is that parents don't always react with as much fear or condemnation
as they used to,
as they might have in the past.
Okay.
And certainly some parents are still very afraid of this. But there are more resources now. People are a little more aware. And so some parents now, if their kid is saying, I'm a girl, despite being assigned male at birth, some parents now are saying, okay, like, if you're saying that you're a girl, then you can be, then we will treat you as a girl.
Well, Cabell, I'm really interested in this. You're saying that sometimes a boy will actually say, I'm a girl when he's 2, even though with all the social pressures and stereotypes and all that?
Absolutely. And this isn't to say that all transgender people know very early, because there are a lot of different ways that people come to a trans identity. But there are definitely young children, toddlers and young children, who will say very firmly that their gender identity is not what their parents thought it was.
We could explore that for a half hour.
Yeah, definitely.
Wow.
There are some great children's books even. Which it's nice to see that, like I said, resources for parents. And then there are also children who might be assigned male at birth and say, I am a boy. But as Gabe was saying, their gender expression is not necessarily what we consider traditionally masculine.
Okay, so the gender identity
Gender identity
might
still
be boy. They look like a boy, but they act like sort of a girl, huh?
So boys who, for instance, want to have long hair, or boys who want to play with the toys that come from the pink and purple aisle at Target, boys who want to wear dresses. People will often refer to this as gender nonconforming or gender creative.
And wouldn't mom and dad go, I think maybe our kid's gay?
A lot of parents would think that, but as Gabe has pointed out, these are actually different dimensions, right? So how you express your gender doesn't actually tell us anything about your sexual orientation, despite we do, as you say, we definitely have cultural associations.
Okay. My bias.
Yeah, and our mainstream cultural bias.
Yeah,
right, is that if a person's acting feminine, that there's some tendency toward being gay for a male.
Perhaps, right. So I think that there's a cultural bias through which a filter would lead us to believe that. And I think that what's important to note is that all these 4 elements, physical, sex, gender identity, gender expression, sexual orientation, are independent factors. Mm-hmm. No one defines any other one. Mm-hmm. They all 4 move independently across a spectrum, across sliding scales. And if we know one does not indicate we know any other one. Which is not what we're taught, because we say, oh, that looks like a boy, so they must have boy genitals or male genitals, and it acts like a boy and is probably straight. Like that's the predominant mainstream model, but that is not actually the truth.
And as Gabe mentioned, any of these can change over time. So if we take what we often think of as a very static identity, so what sex was assigned at birth, people certainly can have surgeries, what we might call gender confirming surgery, if someone feels that their genitals should look different.
These are transgender.
Trans people who might want to change their genital
let's back up, because you're so close to this subject and most listeners aren't. So someone who is born a male but internally feels their sexual gender identity is female.
Right, so someone who is assigned male but identifies as a girl or woman. Yeah exactly. And some people want to change their physical body, and other people don't. So some people might identify as a woman or a girl, but not feel uncomfortable having a penis, for instance. They might not see that as contradicting their gender identity. Other people might. Okay. But you can also consider that sometimes people's hormones don't actually change in the way that we would expect. So, for instance, some people born with a penis and testes might not have high levels of testosterone in adolescence, so that their hormones might actually look more like we would expect a female assigned person's hormones to look. So people can actually have secondary sex characteristics develop that are not what we would expect based on only their genitalia.
Okay, so here's this person with a penis who doesn't have a high level of testosterone. And so what develops then?
They might not develop the same amount of facial hair, for instance. We tend to think of facial hair, muscles, a deeper voice. These are all things that we see as masculine that are associated with certain hormones like testosterone. Another example is actually, I mentioned intersex conditions before. So there are people with what is termed Klinefelter syndrome. So these are people who are chromosomally XY, but they're
XY means
XY is typically masculine, right?
Okay.
Or typically male. But in some cases, a person with XY chromosomes, they are not sensitive to masculinizing hormones like testosterone. So actually in utero, instead of developing a penis, they develop a vulva. The testes do not descend. Basically, their body, for whatever reason, doesn't react to testosterone and other masculinizing hormones.
So they have vagina?
They have a vulva and either a partial or complete vagina.
Okay.
So the vagina
But
is actually the canal.
And their gender identity is?
It's usually female. Usually people, because they're assigned female at birth.
You said male, they're XY.
They're chromosomally XY, but they're typically assigned female at birth because we only see the vulva, right? We see their external genitals. We don't test their chromosomes.
But wouldn't they feel identity-wise like a male? Because
most of the time, they seem to identify as girls and women.
Okay.
And they actually will then develop breasts and wider hips at puberty as well because their bodies don't respond to testosterone. So their body is basically behaving as if it has a very high dose of estrogen because there's no testosterone response.
You're really bending people's minds who've never heard about this subject.
It is really complicated. And I do want to just point out that there are cases of intersex birth where people recognize, they say, oh, this clitoris is larger than is normal. Or a male-assigned infant might have what we call a micropenis, which means that it cannot be stretched to at least an inch. Okay. And it's important for people to know about this because until very recently, medical policy was to surgically alter infant genitals in these cases. Wow. And what that leads to is a permanent loss of sensation. It's irreversible, obviously, and it's conducted on infants who can't consent. And there's no medical reason to do this. It's only because we're so invested in the idea that there are only two sexes and two genders that doctors historically have done surgeries to make infant bodies conform to that binary.
And as Cabell said, this practice is changing in lots of places. Now there's a team-based approach whereby even folks like social workers who are involved in helping families talk through the decision, because that can also be traumatic if an infant is born with what they used to call ambiguous genitalia, and before the emergency surgery is what they would consider emergency surgery is done, now they are more apt to consult with a group of people.
Okay, so when mom goes to see the gynecologist and says, what sex, do they ever get a heads up this might not be a straight-ahead boy or girl physically?
Typically in ultrasound, it's not unusual to not be able to tell for sure.
Okay.
So I'd say most of the time this is something identified at birth.
Okay, so when it happens at birth, how many parents have any idea of how to deal with this? My suspicion would be almost none in straight culture, sexually, but how would they know what to do?
And this is why the Intersex Society of North America does a lot of outreach trying to educate people so that they know that this is a possibility. And it's more common than cystic fibrosis.
How common is it?
Estimates for intersex birth range from anywhere from probably about 1 in 500 is a pretty good estimate. I think that's identified at birth. There are actually a higher number of people who might be, for instance, diagnosed if they're having infertility issues in adulthood. So intersex people are now sometimes included in the LGBTQI for intersex umbrella, but a lot of intersex people don't really identify as part of the LGBT community.
Wow.
Because intersex, again, it has to do with physical, biological sex, which is an independent factor than sexual orientation or sexuality.
So that intersex that's the physical sex, number one you're talking about.
Correct. So,
and their physical sex is ambiguous or has more than one straight-ahead element.
Well, it's beyond just male and female.
What do you mean?
When we talk physical sex and biological sex, it's beyond male and female, and we're including people who might identify as intersex.
Yeah, that's what I mean. I'm saying that intersex has to do, that identified by physical, not by gender identity, gender expression, or...
That's correct.
Right, that's what I meant. Okay.
And we do share a concern with intersex people in terms of bodily autonomy, right? The right to make choices about our own bodies is bodily autonomy. The right to decide what medical treatments we're going to accept, what we're going to do with our bodies, who we're going to share our bodies with. This is something that is really important for intersex people and is also, I think, important for everyone.
But how can an infant make a decision?
Exactly. And as I said, in most cases, there's no medical reason to do surgery, although, as Gabe said, fortunately that's changing now. For a long time, it was the default response was we need to do surgery right away. But I would urge people who are going to have children in the future to really think about how you can respect your child's autonomy as much as is feasible.
Okay. What percentage of people who are about to have a baby born do you think are aware of this at all?
I'm not. I don't birth
You had a
babies,
guess.
so
I would say again, it really depends where you are. Certainly, I have been a teaching assistant for the Introduction to LGBTQ Studies course at the University of Wisconsin-Madison for several years now. I'll actually be lecturing that course this spring, and we always cover intersex issues. Okay. I'll be teaching sociology of gender. I cover intersex issues there too. I try to make sure that at least all of the students who come through my classes are aware of this, and often they share what they learn with their friends, their family, their roommates, and that's the best way to make more people aware. I would say it's a pretty small number now.
LGBTQ.
Yes.
Can you tell us, we'll get back to intersex, what's
Sure.
Q?
So when we use LGBTQ, the acronym Q, sometimes people would use Q to indicate questioning. Other times people use the Q to indicate queer. And so queer obviously has a history as a slur. But for a lot of people, it is a more comfortable term than gay, lesbian, or bisexual because it is more ambiguous. It allows more room. People who feel like their identity is not easy to pin down may prefer the term. In general, I like to quote, there's a video blogger named Jay Smooth who talks a lot about hip-hop and race. And he did a piece talking about reclaiming slurs, and he said, if you're not the original target of an insult, you can't be the one to reclaim it. Mm-hmm. So I like to use that as a rough guideline for who can use the word queer. Certainly some older gay and lesbian and bisexual people are uncomfortable with it because they have a painful history with the word as well.
Similarly, we often talk about the term queer as a yellow flag term, the term that people understand and know about, but because they're not part of a community, may not use themselves. Mm-hmm. But certainly there are lots of young people who say, I will only use the term queer, mm-hmm. because as Cabell said, lesbian, gay, bisexual are too constrictive to me. And I think an overall really good practice is to reflect back the terms that a person uses and allowing someone to self-identify. So regardless what one's preconceived notions of someone's identity might be, letting them self-identify their own identity terms and reflecting those back is a best practice.
Well, you ask, how do you identify? Or
so perhaps if someone says I identify as queer, an appropriate response was, thank you for letting me know. Can you tell me a little bit what that means to you? Okay. Because it might mean something different to me than it does to Cabell than it means to you.
How much is going on in terms of people kind of going back and forth, the fluidity? In the 4 years people are in college, or the 8 years or 9 if you're getting a PhD, do you see a lot of, in terms of these four aspects, people moving around? Well, they're not going to move around in the physical unless they have surgery, right? Or
if their hormone levels change. Think about just somebody who has what we would consider a very quote-unquote normal body. For instance, older women who go through menopause, that involves a significant change in hormone levels. Right. So some people's bodies may naturally experience hormone fluctuations that they may or may not be expecting. Sure. But certainly other people do take hormones specifically to change their bodies or pursue surgery for that as well.
Let me pause. Why should people who are heterosexual and straight as can be care about what you're saying?
Well, I think that, first of all, everyone has a gender. Mm. So even straight cisgender people have...
Cis?
Sure.
What?
So cis, C-I-S, gender means someone... So cisgender is the term... I identify as cisgender because I do not identify as transgender. Okay. So my gender identity matches what I feel my sex assigned at birth is. Yeah. So even straight, heterosexual, cisgender people have genders.
Yeah.
Right? So an awareness of our own gender is important regardless of how we identify. And I would say that even someone who is straight and cisgender has a wide range of their gender expression. So when we say only girls can wear pink, we're also making a statement about what boys are allowed to wear and not allowed. And that type of homophobia and transphobia is actually harmful to everyone.
Okay.
There are actually some studies showing that in schools that have a strong anti-bullying policies geared towards LGBT students, so they specifically work to protect LGBT students, actually bullying for all students goes down. So when we protect people in our community who are vulnerable, we're actually protecting everybody.
Do you feel talking about this subject is the kind of thing I mentioned in the open, kind of familiarity with this whole area will help?
I think so. I definitely think people often need to understand, for instance, that they probably know trans and lesbian, gay, bisexual, pansexual people. And I think it also helps to talk about the issues that affect our community that people may not really realize.
You're both in the college world.
Yes.
So you probably see a lot of people's transitions and developments at this point in their life. Can you give us a little flavor of this feeling of moving around and just maybe examples of people you don't have to name, but people you know, and seeing their changes and going from one aspect of these identities to others?
You know, when I think about some of our college students who, and people in general, as they develop these identities, I think about an example in college. So, for example, if you have a freshman, a first-year student coming into college, and they say, I don't know what major I'm going to be, right? We don't automatically say, like, no, you must be an engineering major. We often say, like, oh, see what works for you, see what figures out. Now, it's not a perfect metaphor, but it's the same sort of thing. We don't want to say, like, you must be straight or you must be gay. But what we do want to say is there are communities with which you might identify across the spectrum. And it's okay not to know. So that's one of the first things is engendering a comfort with ambiguity is very important.
It's okay to not be sure.
It's absolutely okay. And actually would prefer you not to be sure.
Rather than force.
Absolutely.
Rather than force it.
Right.
And what's the downside of forcing it?
The downside of forcing it, I think that there's a lot of internalized homophobia or internalized transphobia, the sense that the world belief in the misinformation about the true lives of people, and then internalizing that. That can be dangerous.
Can you give me an example?
So, for example, if some kid is growing up in the Midwest in a Catholic family, very conservative family, very deeply religious, and they say, I'm feeling different about myself, and that kid says, maybe I'm gay. But the only messages they get about gay people are that they're going to hell, they're dying alone, they're going to die of AIDS, and can't have families. What kid's going to say, okay, I'm in?
Right. Right.
They're going to say, no way.
Okay.
Absolutely anything but.
But could you also be coming from a culture that was more open-minded than that, but you're still confused? There's still transitional issues.
Sure, and I can give another example.
Sure.
So as I mentioned, I'm the chair of Wisconsin 521, and we focus specifically on bi and pan people. And people are often less familiar with the term pansexual. Pansexual people experience attraction to more than one gender. Some pan people would say that they experience attraction without regard to gender. So
Isn't
gender.
that bisexual?
So there's a lot of overlap. Some pan people would say they experience attraction without regard to gender. Gender is not a factor. Some bi people might actually say the same thing. So these are two identity labels where, again, people may have very similar patterns of attraction and behavior, but identify somewhat differently. Personally, as a bisexual woman, I would say that gender is a factor in my attractions. There are some gender expressions that I find attractive and others that I don't. For instance, I like to say, I find many men attractive, but Ben Affleck is absolutely not. There's just something about Ben Affleck's masculinity that really doesn't do it for me. So for me, gender is important, but I am attracted to more than one gender.
I'm still not clear on understanding that in bisexuality because
I am bisexual.
You're bisexual.
Yeah. So that,
why aren't you pan? sexual?
For one thing, I didn't learn the term pansexual until I was in probably my mid-20s. I've identified as bi since I was about 14.
But now that you know it, why are you not a pansexual?
As I said, some pan people would say gender doesn't matter, and I definitely feel like gender does matter. So for me, that's a point of difference between the labels.
Well, so for example, I don't identify as pansexual, from my understanding of it as a gay man. So if someone, a pansexual person might say, I'm attracted to people who are strong and stubborn, regardless of their gender identity, expression, or physical sex. Right? And so we're attracted to aspects of people regardless of their body parts or expressions.
I do want to say, and this is a problem where people often think that sexual orientation is about body parts. And so people will sometimes say, well, if you're bisexual, that means that you must only be attracted to cisgender men or women. And the problem here is that
cis being, again, traditional.
People whose gender matches their assigned sex.
Okay, yes.
Right? The problem here is that we almost never base our attraction to other people based on their genitals, because we don't see their genitals. When you're on the street and you see someone and you think that they're cute, that really has nothing to do with their genitals, because they're probably not walking around naked. And so I do think it's important to emphasize that for most people, there may be particular sex acts that they enjoy or don't enjoy, but really that doesn't come down to other people's genitalia. I like to tell my students...
Wouldn't that, if you were surprised at what you found?
So this is an issue, right, that people may be surprised, but I always ask my students, okay, so sometimes students think, well, if somebody's genitals are not what you would expect, they should tell you. And I say, okay, so should cisgender men tell you exactly how big their penis is before they take off their pants? I'm like, is there some penis size where you feel like you need a disclaimer before you're willing?
Can I play devil's advocate here? I don't think, again, straight to straight, if a woman has sex with a man and he has a smaller or bigger penis, she's going to say, you lied, or you deceived me, or whatever, as much as a man has sex with a woman he thought was a woman, and it's a man with penis, or...
A woman with a penis.
A woman, I'm sorry. Right.
And so I would say we do think of those in our culture as very different things, but my question is why? Because we have decided that this particular category is so important, we think that that is a bigger difference, right? But there isn't actually anything, as Gabe mentioned, these are two different parts of a person. Their genitalia and their gender are actually separate aspects of the person.
Thank you both so much for expanding our worlds. And I hope you'll join us on the next edition of Insights. And remember, you can find all our podcasts at dickgoldbergradio.com or search for Dick Goldberg at iTunes or YouTube.